Hello, I'm Tim, the Minnesota Firefighter with ARMM cancer. I was formally diagnosed with cancer on December 3rd, 2018. Last week I received my fourth round of immunotherapy treatment with ipilimumab and nivolumab. I met with my local oncologist for the first time since late December. My original treatment plan included 4 rounds of dual immunotherapy treatment, transitioning to a single immunotherapy drug given by infusion once every 2 weeks. My local oncologist ordered a new PET scan. This will be the first imagery since starting treatment. Immunotherapy uses the body's natural defenses to fight cancer. This creates inflammation, and PET scans have difficulty distinguishing tumor from inflammation. Waiting until after 4 rounds of dual immunotherapy allows time for treatment to work. My original imaging showed and biopsy confirmed that my cancer involved an inguinal lymph node in addition to the tumor. I'm hoping to see tumor reduction and, just as importantly, keep the cancer localized. There is a Mayo group that only treats patients with melanoma. That means they have a greater specific knowledge and much more experience treating malignant melanoma. We want their input on my progress and how we proceed moving forward. I have a referral to see my Mayo oncologist for a consult after we complete the new PET scan imagery. Mayo will review my case, including the history of my blood work while on immunotherapy and any updated imagery. We will discuss the best adjuvant treatment. Do we still transition to a single drug versus continuing the dual immunotherapy treatment? Reviewing tumor size and location may also present a surgery option. My body's done really well handling the dual immunotherapy treatment. My local oncologist reviewed and discussed the side effects that I've experienced. For me, the biggest side effect has been fatigue. It was quite significant early on. I had days I felt pretty good, then suddenly it felt like I hit a wall and just needed to sleep. The fatigue episodes have gotten better over time as my body adapted to the nivolumab and ipilimumab. Their trade names are Opdivo and Yervoy. The last week to 10 days has been much better. I'm sleeping better, and that certainly makes a world of difference in regard to fatigue. I've experienced rashes that appear as isolated bumps over my lower neck, upper chest, my shoulders and forearms. They present like pimples without a head, and some look like lesions that my primary physician has called seborrheic keratosis. I've had some isolated keratoses for years. For the most part, I've experienced very little itching with the bumps and the keratosis. A month ago, my forearms were covered with bumps and keratoses, but today they're much fewer. In some cases, the bumps have gone away and the keratoses have actually crusted over and fallen away. My local oncologist seems skeptical that this side effect has gotten better as treatment has continued. I hope this just demonstrates how well my body is adapting to treatment. In my last update, I spoke of 2 other side effects, and upon further reflection and speaking with members of my Mayo Cancer Club, I now realize that with one exception, my shortness of breath was probably tied to physical activity. It has occurred in conjunction with climbing stairs and moving snow. I guess more to the point, due to a lack of exercise over the last 6 months, I confess I'm pretty out of shape. Wow. An overweight, underconditioned fat guy. Who would have figured? I'll talk more about exercise and cancer fatigue in another update. The other side effect was musculoskeletal pain. Just like being short of breath, I can now tie it directly to recent activity, including shoveling some snow and or running snowblower. I only had a couple times when I experienced intense muscle and joint pain. Both times the pain started around bedtime and lasted about an hour. Fortunately, both times the pain didn't last and I was able to get to sleep. So, reviewing my side effects, I think I've experienced fatigue and skin rashes. And after 3 months, I'm at a milestone or benchmark, having completed 4 rounds of dual immunotherapy infusions. My local oncologist calls it a branching point. We'll complete imaging to see if we've slowed tumor growth and disease progression. We'll consult with the Mayo melanoma group to confirm shifting to a single immunotherapy or continue with dual immunotherapy. If there's tumor reduction and no spread beyond the local area, then we'll discuss future surgical options. So to conclude, I'm feeling pretty good. My energy's better and the fatigue is much more manageable. My rash and bumps are clearing up and there's been very little itching. So as I mentioned previously, I'm researching cancer fatigue and the best ways to counter it. I hope to do a video update to discuss that cancer fatigue in the future. So in the meantime, I certainly appreciate the well wishes of so many people who've reached out to me. I'm extremely grateful to the cancer support group in my local area that there's a team of firefighters that have helped make sure I don't overdo it with my driveway. And when we get these 5+ inches of snow, they've been pretty quick to come and help clear the driveway. I really can't begin to say how much I appreciate that help. So again, I will keep you updated as we move along. PET scan scheduled for the 14th of March. Hopefully we get into Mayo within a couple days of that PET scan, because my next scheduled treatment is the 20th of March. And I certainly would like to find out, do we move forward with single immunotherapy or do we continue on the dual immunotherapy? Really want to know what Mayo's thoughts are on this process. So, thank you.